apocalypse.
Hey, how you doing? Good to see you again, and welcome back to the show. Thanks for stopping by. As always, I hope this finds everybody safe, healthy, and in good spirits. And for everybody, hit that subscribe button and the bell icon. Appreciate it. Everybody gave the thumbs up. I appreciate it. Anybody new here who hasn't already, I would appreciate you hit that thumbs up button or something like that. Hit the subscribe button and hit the bell icon. This way you know the next time I come out with a video. So I came across a little information on the COVID-19 about, did you have it and you don't realize you had it? A lot of the symptoms were different. A lot of people got hit hard with it, you know. A lot of people passed away from it. A lot of people were sick for a long time. But there's some cases that the signs or symptoms were so small and early on that we might have had it and didn't even realize it. Are you one of them? Am I one of them? I'm not sure. I'm going to read some signs here that you could have had it. And it's always good to get tested. I mean, I definitely got tested myself. I definitely don't have it. The antibiotic test, whatever, the test to see if you did have it, it's good to take. But here's some signs of where you could have had it and didn't even realize it. And it's past, it's gone, all right? So check this out. Could you have had COVID-19 and not even realize it? Possibly. The majority of people who contract the coronavirus will experience mild symptoms. The most common being a high temperature and a new, dry, and continuous cough. A smaller percentage of people will experience more severe symptoms. However, because the coronavirus actually has a spectrum of symptoms, some so mild they are barely noticeable or easily confused with something else. They can go unnoticed or undiagnosed. Runny nose, sore throat, congestion. Dr. Atkinson maintains that the trifecta of a runny nose, sore throat, and congestion can signify a mild case of COVID-19. However, because it sounds and likely feels a lot like the common cold or hay fever, many people just brushed it off. You know, I mean, how many times you coughed, you sneezed, all that kind of stuff, and it's just like you brushed it off. And early on, you might have just thought it was a cold or a fever or whatever, and you might have actually had the COVID-19. Reduced or loss of sense of taste and smell. Now, here's something crazy, too. If you lost your smell or your taste for a little while, it's a sign that you could have the COVID-19. Some people experience a loss of their taste and smell may have contracted the coronavirus. It's a symptom that might accompany really mild symptoms like those not dissimilar to the common cold, runny nose, congestion, and sore throat, but it can accompany the very mild symptoms such as muscle aches, fatigue, fever, and continuous cough. So that's crazy. If you have that, no taste, no smell, you got the little runny nose, this and that, all signs you could have had the freaking coronavirus. Or reducing your appetite. Did all of a sudden you just not get hungry? Not why? I don't understand why I'm not eating. Dr. Atkinson adds that when your body is infected by a virus like COVID-19, your appetite can become reduced. If this is accompanied by a loss of taste and smell, it can make wanting to eat or drink really difficult. It's really important to drink a lot of fluids to help your body combat the virus. So saying drink a lot of fluids and stuff. Breathlessness. A novel coronavirus is a viral infection of the upper respiratory tract. Things like coughing, a sore throat, and breathlessness can occur as symptoms. Well, the most common is a dry, continuous cough, and it's often reported that that's what comes with that. The feeling kind of like, you're out of breath and you're coughing and it's a dry cough. In other words, you're not coughing mucus up, you're coughing, nothing's happening, it's just dry. If you had that, you could have had the coronavirus. Tiredness and fatigue. When your body is fighting any kind of infection, it uses up energy. Most people feel tired and lethargic, so won't be exercising or going to work when they're ill. But some fitness enthusiasts insist on continuing with the exercise to try to battle it through. So again, you're tired, you don't want to do nothing, you feel, out of it, but you fight through it, because you have the symptom, but it's not that bad where it's knocking you down where you can't move. Something called COVID toes. Dermatologists have observed purple lesions on the feet and hands of some patients with COVID-19 infections. So another thing, if you all of a sudden have like these purple lesions or bumps on your toes, and sometimes on your hands, this could have been a sign of COVID-19. Now maybe it just came and went. You didn't really realize. You just, what the hell is this? And you just brushed it off. But that's signs of the COVID-19. These lesions are most often found in otherwise children and young adults and may be itchy or painful. Pink eye. Pink eye's been around forever, right? Somebody gets pink eye, you don't even think about relating it to the COVID-19. If you have recently suffered from conjunctivitis, aka pink eye, it could have been due to COVID-19. Several reports suggest that SARS-CoV-2 can cause a mild conjunctivitis, otherwise indigestible from other viral case causes. So they're just saying that you could have got the pink eye. That comes from a lot of different things, but it could have been caused by COVID-19. So another sign, if for some reason you had pink eye, or your child or somebody you knew had pink eye, good possibility you had it. Here's another one that's normal, everyday life things, but could be caused by the COVID-19. Diarrhea or nausea. According to the CDC, some persons with COVID-19 have experienced gastrointestinal symptoms such as diarrhea and nausea prior to developing fever and lower respiratory tract signs and symptoms. So you're going to get your diarrhea, you're going to drop, whatever the case may be, and then also you get that fever. And I guess this all combined together is showing signs of the COVID-19. Something else that we just kind of brush off, so that's something I ate, whatever the case may be. A fever spike. Did you have a fever that came and went so quickly you brushed it off? Well, it could have been COVID-19 according to the World Health Organization's 87.9% of 55,924 laboratory-confirmed cases of coronavirus reported a fever, making it by far the most common symptom. That's why now you're getting checked for temperature all the time when you go into buildings or wherever you go. They want to check your temperature, because if you have a fever, it might just be a fever, it might be regular, but most commonly cause of the fever now is the COVID-19, and that's what they're relating a lot of it to. So you got to be careful with that. Muscle pain, another thing, everyday thing that we could have that, we can't determine whether it's from the COVID-19 or just regular pain. Muscle pain. Perhaps you wrote off body aches, pains, and soreness due to overexertion, or maybe you thought you had the flu. However, according to the CDC, muscle pain is a symptom of coronavirus. Crazy stuff. Here's one you got to be careful of too. COVID rashes. The skin is often a window into a person's health and may show signs of COVID-19 infection. Rashes may present as small blisters, measles-like, many often pink to red bumps that can merge together, and hives, itchy red wheals on the skin. Purple skin lesions reported in patients with COVID-19 range from itchy to painful bumps on the hands and feet. It's important to note that these skin signs are not specific, meaning they can be associated with other infections. So in other words, they're saying, again, bumps, lesions, rash could be caused by COVID-19. If you had this, you might have had, or it could just be another cause of something else. So they're kind of determining that a lot of these things are related to the COVID-19, but you might brush them off as just the normal things that always happen, and not realize you just had the COVID-19 and you just got past it. Disorientation. Some COVID-19 victims suffer from disorientation and confusion. One study published found that over a third of hospitalized patients in Wuhan, China, showed neurologic manifestations of the disease, including loss of balance or coordination, loss of consciousness, and seizures. Here's another thing too. Now, if you haven't had any problems with your, balance or walking, or all of a sudden you're having a seizure or something, this can also be causes or signs of this. Anything different like that, I mean, when our body's telling us something different is happening, we always got to get checked out. And, these days you never know who the hell ever just expected this thing to come here from Wuhan, and it hit us. So it's always better to be safe than sorry. Always get yourself checked. You think something's wrong, you're not sure. I know we all want to be doctors and analyze ourselves and tell ourselves what the problem is, but sometimes we just really don't know. A dry cough. A dry cough is one of the defining symptoms of COVID-19 according to the WHO. What is the difference between a wet and dry cough? As the name implies, a wet cough will likely produce mucus, while a dry cough is just dry. All right, so you got to be careful with that. Chills or repeated shaking. There's another thing, chills and shaking. You think you got the flu or cold, whatever. The CDC makes 6 new additions to their official list of COVID-19 symptoms. Amongst them was not only chills, but repeated shaking and chills. The symptoms generally go hand in hand with a fever. So again, you think you have the fever, this and that, whatever the case may be, and we brush it off. It's okay. Could possibly have been COVID-19. You possibly could have had it. It's gone. It went out of your system. You're finished. If you got it today, that's a problem. Whenever you think you have a problem like that, go see the doctor right away. Get checked. How about a throbbing headache? A lot of us get it every day. We think it's probably from the people we're with or whatever the case may be. But anyway, if you feel a jackhammer in your head, it may be COVID-19. Findings from an observational study of more than 100 patients show headaches onset may occur during the pre-symptomatic and or symptomatic phases of COVID-19 progression, and sometimes mimics tension or migraine headaches. So again, they're saying right now, and as you all know, there's some big words or stuff I just can't pronounce, but in layman terms, if you got a headache and it's pounded, you think it's just, one of those regular migraine headaches or sinus or whatever, make sure you get checked out or whatever the case may be, because there's good possibilities it's related to COVID-19. Chest pain. And we all know anyway, you get chest pain, you need to go check it out right away anyway, but they're kind of linking it now to COVID-19 too. Some people say they continue to experience symptoms months after having the infection. In doctor visits on social media groups, a growing number of patients report lingering symptoms ranging from mild issues such as continued loss of taste or smell to more serious ones such as heart palpitations, chest pain, shortness of breath, extreme fatigue, conjunctivitis, difficulties of recurring fevers. Will these symptoms eventually resolve, or whether they signal permanent damage from the virus remains unknown. So again, people are getting these stuff that's going, after and after and after the fact that they had it, and now they still got these symptoms. How about this, a scary one right here, and I never heard this one before either. Loss of speech or movement. People of all ages who experience fever and or cough associated with difficulty of breathing, shortness of breath, chest pain, pressure, or loss of speech or movement should seek medical attention immediately. No kidding. I would definitely, you definitely got to, seek something immediately for any of these things right now. Because again, we're in such different times right now where years ago you'd have a cough, a sneeze, a fever, you're sitting in the ice bed, you cover it up, you take your medicine, do what you got to do, and it goes away. But today's times, any kind of sign of something different in your body, you got to go have it checked out. Who the heck knows what's going on? You become forgetful. Our experience with previous forms of coronavirus suggests that in long-term patients may develop depression, insomnia, Parkinson's disease, memory loss, or accelerating aging in the brain. That's crazy. For those recovering from COVID-19, I recommend regular exercise, eating a healthy diet, reducing stress, and improving sleep. These are critical ways patients can rejuvenate their brain and minimize having poor outcomes in the future. So if you have it real bad, you know, I mean, it's a shame. You got to do things just to kind of get yourself back healthy again. I mean, it's just a shame how many lives are lost, how many people are sick in hospital for so long, you know. You were sick early in the year. If you were sick in January or February and brushed it off as a flu or cold, it could have actually been COVID-19. Well, the first known case of coronavirus in the United States was reported in early January. Community spread didn't appear to be an issue, or so we thought. In fact, it was until late February that the Center for Disease Control and Prevention, CDC, confirmed the first case of COVID-19 in a patient in California who had no known contact with anyone who had been diagnosed with the virus or no travel history to an outbreak area. Crazy. So there's a lot of the signs that we could have had, and we could have possibly had COVID-19. I mean, the widespread of it, the way it's popping up. A lot of states had it early on. New York was one of them. We were the main place was having. We got it down. And they were saying, remember they were saying the hot spots is not, coronavirus isn't getting there. The COVID-19 is not working there, like Arizona, Florida, Mississippi, California. They're saying that all these places, because it's so hot, Texas, the coronavirus isn't there. Well, what's happening today? All of those spots now are high in the coronavirus pandemic. Seems as though Florida is really going crazy right now. Texas is really having a problem. So I don't think they really understood at the beginning that the hot weather won't keep the virus away. So we got to just keep doing what we're doing. We got to keep on keeping our social distance, keep on wearing a mask for now until this gets figured out. You know, until we figure out what the hell actually is really going on here. People are still losing their lives. People are still getting sick. You know, a lot of people are saying that, you know, it's all political, this and that. I don't know. You know, I don't like to get into politics. I don't get all that kind of stuff, but a lot of false reports out there. I was watching a video where one doctor, a woman doctor, was actually saying that there's a medicine you can take to cure it, to do it, and nobody's not confirming this. They're looking at other ways. So I don't know. All I know is everybody please stay safe, stay healthy, do the best you can to not catch this COVID-19. Take care of your elderly, take care of the kids. Let's hope that this is something in the future, in the soon future, we can talk about this as being past and gone. Again, guys, I appreciate you all coming, stopping by. Hit that thumbs up. Don't forget to hit that subscribe button and hit that little bell icon next to it just so you know I come out with a video. Until next time, stay safe, stay healthy, and just take care of yourself. Take care.